Right, I've come to my 6th day of feeding, and I've been nil by mouth now since last Monday, so 6 days without having anything to eat or drink. And I thought it would be worth just trying to see what it feels like to have some oral diet whilst having the tube still down. Many patients, including patients with motor neuron disease, end up having the texture of their food modified if they're unable to swallow sort of more solid foods. So I've produced a range of consistencies here that they may well have to be eating. So the first one is my liquidised diet, which is liquidised chicken dinner from earlier. So it's just like a drink, probably a bit like a chicken soup, so I'm going to try that. And yeah, that slides down past the tube without any problems, and it's quite nice. The next one is some puree diet, so again puree chicken dinner. So it's a bit thicker. Take a bit of a bigger, and that I definitely, as I swallow, I can feel the tube moving in the back of my throat, and actually it just seemed to have sucked it down a bit. It's a bit strange actually, as I'm guessing. As the food's going down my food pipe and I'm swallowing, I can feel the tube dragging down with it. So I'm guessing some of the food is clinging onto the tube as you eat it, and I can feel it caught at the back of my throat a little bit. So whether it's just sort of clinging onto some of the tube. And it is a little bit, it's not the easiest thing to swallow actually. It does take a few, it just feels like there's quite a lot sticking maybe to the tube. The last thing I'm going to try is some more sort of mashed diet, sort of a bit of cottage pie. So let's have a go at this, which is a little bit more solid, so I'm wondering, let's see how that. It is quite difficult to swallow with the NG tubing, which I'm surprised about. So I can just feel it caught at the back of my throat. So yeah, having the NG tubing definitely gets in the way of swallowing a little bit. I'll just try the mashed potato. So yeah, it's not that. It just feels like then it's clinging to the tube. I can just feel it at the back of my throat. Don't feel like it's going down the wrong way or anything, but I just feel like that the food is catching at the back of my throat. So yeah, that would make it harder for patients, I guess, who are coming off naso-gastric feeding to push on with their oral diet if that's how it felt all the time. It's not that comfortable, and I guess if they had a bit of a swallow problem as well, I'm just wondering if that food is stopping at the back of your throat, maybe near your windpipe, which wouldn't be particularly safe. So yeah, that's. And same with this. See, when you swallow, I can feel the tube dragging in against my nose. So I'm guessing that the peristalsis, the movement of my esophagus moving the food down my food pipe is also dragging the tube down with it, which is a bit of a strange sensation. So yeah, so that is eating with an NG tubing. Okay, I shall catch you later.